So today we are going to discuss the landmarks of maxilla. First, we are going to see the limiting structures that make the boundary of the maxilla. So there are these elevations on the borders. These elevations are known as frenums, and these are the depressions. These are known as vestibules. This frenum is towards the lip side, so it is known as labial frenum, and this frenum is towards the cheek, so this is buccal frenum. This vestibule is towards the lip, similarly this is known as labial vestibule, and this vestibule is towards the cheek area, so this is buccal vestibule. Labial frenum, labial vestibule, and buccal frenum, buccal vestibule. Now moving on to the posterior side, these pink areas, these areas denoted with pink color, these are hamular notches. These are present between the maxillary tuberosity and the pterygoid hamulus. So these hamular notches are also, they also come under the limiting structures. Then posterior palatal seal area. Posterior palatal seal area is this dark green color, and it is a Cupid's bow shape. Then moving on towards this area, these 2 points, these are called fovea palatine. Now moving on to the supporting structures of the maxilla. Maxillary tuberosity and these rugae, these are the supporting structures of this maxilla. Then come relief areas. The areas which cannot apply, the areas at which we cannot apply much pressure because there could be some nerves or vessels present there. So when we apply the pressure to such areas, the patient will feel pain and discomfort. So these areas have to be relieved. So when we see this line, this comes from posterior to the anterior part. This is mid-palatine suture. Then anteriorly, this is incisive papilla. Incisive papilla, it contains nasopalatine vessels. Torus platinus is these prominences on the palate. This is also covered with thin mucous membranes. Then comes cuspid eminence on the side of the canines. The sides where canines are present on the maxilla, we can see cuspid eminence. So these 4 structures are the relief areas of the maxilla. Now we're going to discuss the primary stress bearing areas and the secondary stress bearing areas. Primary stress bearing area is the horizontal slope of the hard palate, this slope of hard palate. And in the secondary stress bearing areas, there are 3 structures. This green part here, this is the crest of alveolar ridge, and these rugae on either side of the maxilla, this also comes under secondary stress bearing area, and this maxillary tuberosity. Thank you so much.